Hi, welcome to the June 2026 Rapid Update in Therapeutics. I'm Tessa Lewis, GP with interest in therapeutics and the care of older people. And today I'm going to talk about some mimics in medicine and an MHRA update. So looking at the latest AWMSG National Prescribing Indicator Quarterly Report, we've seen improvements across Wales in antimicrobial stewardship measures for the quarter ending December 2025. So we've had a reduction in the total volume of antibiotics prescribed, reduction in 4C antimicrobials, and improvements in the course length for uncomplicated respiratory tract infections, with 5 days rather than 7 days being prescribed. So all this should result in reduced exposure to antimicrobials and reduced risk of antimicrobial resistance and adverse effects for our patients. The prescribing data for flucloxacillin is interesting. So here we got the volume of flucloxacillin 500 milligram capsules over recent years, and it shows clear summer peaks. And evidence also shows or suggests that 75% of people presenting to the GP with an insect bite or sting will receive an antibiotic. So this brings me to my first of my mimics in medicine. So it can be quite alarming, can't it, when someone presents with a large area of redness, and stings definitely mimic cellulitis. But if there's a clear history of a bite and sting and rapid onset of itching and redness, it's more likely to be inflammatory or allergic. And as Nice points out, most insect bites or stings won't need an antibiotic. It's still important to check for the symptoms and signs of infection and consider the person's individual risks from their comorbidities or their medications. And we want to take extra caution if the bite or sting is in the mouth, throat, or around the eyes. Other things to think about is whether or not this could be a tick, or if it's a more unusual or exotic insect or from outside the UK, then management will be different. As always, we need to safety net people, reminding them to seek medical advice if the symptoms worsen rapidly or significantly at any time, or they become systemically unwell. But the bottom line is the sudden onset itchy redness following a bite. Consider self-care, and the NHS website has got good information on that. Also important to remind patients not to scratch, because that does risk secondary infection. So there's a much fuller discussion of this on the RCGP Target Toolkit website under webinars and learning resources for prescribers. The next condition, which can mimic others, is temporomandibular joint dysfunction, and that can present as earache, facial pain, headache, or suspected sinus, and it's not always recognised, and that can lead to antibiotics or analgesics, which might not be the best option. It's typically felt just in front of the ear, and the discomfort can radiate around their ear or head, and is exacerbated by jaw function. So if you ask the person to press in front of the tragus and ask them, or you can identify the joint, ask the patient to open their mouth, and if that reproduces the pain, it's very helpful diagnostically. So you need to think about other pathologies that could be causing this problem, but if you've excluded other causes, we're reminded to use a biopsychosocial approach to management. And there's more information on this on CKS, and there's, as before, good information for patients on the NHS website. And the final condition that I'd like to mention is osteoporotic vertebral fracture. People can present with fairly non-specific symptoms such as unexplained chest pain or abdominal pain, and it can lead to a lot of investigations and prescriptions unless we think of the possibility of osteoporotic vertebral fracture. So important to consider, especially if there's height loss or the patient's on steroids. So the MHRA have updated their alert on finasteride and tutasteride. The report in 2024 led to the development of patient cards. Finasteride is indicated for male pattern hair loss at the 1 mg dose and benign prostatic hyperplasia at 5 mg. And the yellow card reports were mainly from patients treated with a 1 mg dose. So we need to ask patients about depression and suicidal ideation and advise them to read the patient cards and leaflets if we're prescribing finasteride. So in summary, we've looked at some mimics in everyday practice, particularly insect bites and stings, temporomandibular joint dysfunction and vertebral collapse. Thank you for listening.